Are you a sufferer of low back pain, possibly sciatic pain? This could have come from a recent onset. Maybe it's causing pain in your buttocks or down your legs. If you answered yes to these questions, I'm really excited for today's video because we're going to share with you Robin McKenzie's exercise system for decreasing and getting rid of sciatic pain. Robin McKenzie was a physiotherapist from New Zealand in the 50s, and through chance observation and a lot of research, he came up with an amazing system that's now taught all around the world to manage, decrease, and even cure sciatic pain. Let's get into the video and let's take a look at some of the exercises. Hey, well, welcome back to another episode of Physio Tips with Mauro. I'm your host, Mauro Burnett. For those of you that don't know me, I'm a board-certified orthopedic specialist in physical therapy and the owner of Australian Physiotherapy Specialist Physical Therapy Center here in Jacksonville, Florida. For today's video, I'm really excited to talk about Robin McKenzie. Robin McKenzie's story is pretty amazing. He's this physiotherapist in the 50s that one day in his clinic, he asks a patient, hey, I want you to go and lie down on one of the tables on your stomach. I'll be in a few minutes and we're going to take a look at you. Mr. Smith, terrible low back pain for the last 6 weeks and pain going down the leg. When Robin McKenzie goes into the treatment room, someone had left the table bent up and Mr. Smith's laying on this table arched back, and he asks, Mr. Smith, how are you doing? Mr. Smith replies, this is the best I've felt in 6 weeks. Wow, this wasn't supposed to happen. This type of positioning was considered to be dangerous or injurious to the back. But this set off decades of exploration into positioning and positioning type exercises to help decrease sciatic pain. In this video, we're going to give you 4 of Robin McKenzie's exercises to help decrease sciatic pain. Let's also take a minute and talk a little bit about precautions. If you have a sudden onset of low back pain, it's persisted for 10 days or more, it's not getting any better, these exercises may not be for you. If you have severe unusual symptoms, maybe bowel and bladder changes or severe numbness and weakness in the feet, maybe these exercises aren't going to be for you. If you have spondylolisthesis, that would be a diagnosis that says you have a fracture in your spine. These exercises are definitely not going to be for you. So unusual symptoms, prolonged period not getting any better, this may not be for you. But if you don't have those precautions, there's a good chance that these exercises may help. Try a small dose, see how you do. Make sure when you're using the exercises that it's making you feel better and not worse. Any exercise that makes you feel worse is not on your side, and you should probably discard and check with your physician or your physiotherapist. All right, now that we've gone over the precautions, let's get into exercise number 1 of Robin McKenzie's centralization exercises. Exercise number 1. Lying on your stomach face down with your head turned to the side. Your arms are resting by your side, elbows straight and relaxed. You stay in this position and then take a few deep breaths and then relax completely for 2 or 3 minutes. You must make a conscious effort to remove all the tension from the muscles in your lower back. Without this complete relaxation, there's no chance of eliminating any distortion that may be present in the joint. Exercise 1 is used mainly in the treatment of acute back pain that's become recently and is sharp as opposed to chronic back pain. In fact, exercise 1 is one of the McKenzie method's first aid exercise. If you just hurt your back, this would be one of the first things that you would do. This exercise should be done once at the beginning of each exercise session. Ordinarily, you should do this exercise once per session, but you may feel free to do it more often than that. Exercise number 2, lying face down, propped on your elbows. Exercise number 2 must be done only after performing exercise 1. Remember, remain face down in the same position that you were in exercise 1. Now place your elbows under your shoulders so that you can lean on your forearms. During this exercise, as with exercise number 1, begin by taking a few deep breaths and then allowing the muscles in your lower back to completely relax. Try to remain in this position for 2 to 3 minutes. If you find this painful, you can always put a pillow or two under your stomach and attempt the position with the pillows. As you start to feel better, you start to remove one of the pillows. Finally, remove all of the pillows. The goal would be to maintain this position for 2 to 3 minutes. However, if it's too painful, do what you can do. Maybe it's only 30 seconds to start, and you can progress as you go there. Remember to do this 6 to 8 times per day or every 2 hours. If you experience acute increasing back pain when you attempt this exercise, or it's driving the pain further into your legs, further down towards your feet, then you would discontinue that exercise. There is a trick that you can try to modify before giving up on the exercise. While you're lying on your stomach, if you shift your hips 2 or 3 inches away from the pain and then redo exercise number 2, you may find that this is helpful. By shifting away, if you're lying on your stomach, for example, your pain is on the right side, maybe into the buttocks or the right leg, you shift your hips 1 or 2 inches to the left, creating a slight side bend to the right while you're lying on your stomach, propped on your elbows. Exercise number 3, extension in lying. Before doing this exercise for the first time, start your exercise session with exercise 1, lying on your stomach for 2 to 3 minutes, followed by exercise 2, propped on your elbows for 2 to 3 minutes. Remain face down, but with your head forward rather than to the side. Each time you straighten your arms, remember to hold the sag for a second or two, because this is a key part of the exercise. If you feel your pain is decreasing or centralizing, that is, the pain started lower in the leg and now it's moving up closer towards the back, then you may maintain the sag for longer than 1 or 2 seconds. As with all other McKenzie method exercises, remember to slowly think or say your words, pressure on, pressure off, as you do the exercise. This helps you to hold each position just long enough and establishes a rhythm in which to do the exercise. Exercise 3 is the most useful and effective first aid procedure in the treatment of acute low back pain. Exercise number 4, extension in standing. Stand upright with your feet slightly apart. Place your hands in the small of your back with the fingers pointing backwards. You are now ready to begin exercise 4. Bend your trunk backward at the waist as far as you can, using your hands as a fulcrum. As you do this, it's important that you keep your knees straight. Once you've maintained this position for a second or two, return to the starting position. Each time you repeat the cycle of movement in this exercise, try to bend backwards a little farther so by the last repetition, your back is extended as far as possible. You should repeat 10 exercises per exercise session, and like the other exercises, you could perform this every 2 hours during your day or 6 to 8 sessions. A good time to use the standing extension exercise is when you notice when you bend forward to put on your shoes and socks or any type of bending forward activity, it makes your pain worse and causes pain maybe to go down your buttocks or into your leg. If you notice a pattern, try extension, the opposite of bending forward, and see if it reduces the pain into your buttock and leg. Maybe you try a trial of 5 to 10 reps and then stand and walk around for a few seconds and see how you feel. Well, thanks for watching today's video on sciatica relief exercises. I hope you got something out of it. If you did, don't forget to hit that like button below. Remember, you can always subscribe to our channel to receive more videos like this in the future. Good luck for now. We'll see you next time on Physio Tips with Mara.